Hello, everyone. I'm delighted to have you here on behalf of Future Care Capital. We are looking forward to hearing our two speakers, fantastic speakers, Stephen Ginnis, Research Director of Ipsos MORI, and my colleague Annemarie Naylor, our Director of Policy and Strategy. And as you know, we're here to hear about public health communication during a global pandemic, and particularly to learn from last time, the lockdown earlier this year. And I suppose we didn't realize it would be quite as topical as it has turned out to be today. So before I hand over to the speakers, I just want to invite you to pose questions. We will have the chance to have a Q&A at the end of this session, and just in time to wrap up by 5 o'clock. So please just pop them in the box that's on your screen, and also ask any technical questions that you might need from Workcast, who are on hand to help us. So let me introduce our speakers. So Stephen Ginnis leads Ipsos MORI's Innovation Network in the UK. He's also the Global Innovation Lead for Public Affairs. He leads in the use of mobile research, social media analysis, text analytics, and much more. Stephen is an expert in online harm, including policy issues such as advertising and online targeting. And then after he has spoken, we will hand over directly to Annemarie Naylor, MBE, who is FCC's Director of Policy and Strategy. Annemarie has a background in public policy, working with local, regional, and national government here in the UK. She shaped and led this research project with Ipsos MORI on behalf of Future Care Capital. Annemarie is the author of numerous publications in health and care, with a particular emphasis on data-driven innovation and the deployment of new technologies. In a previous role, Annemarie established the Asset Transfer Unit, overseeing national programs to transfer publicly owned land and buildings to communities. And in 2015, Annemarie was awarded an MBE for services to community asset ownership. So I'm really looking forward to hearing from Stephen and then Annemarie, and then hearing your questions afterwards. Over to you, Stephen.
Great, thank you, Sue. And just to check that everyone can hear me, I hope that's the case. So yeah, thank you for the introduction. My name's Steve Ginnis, and I've had the pleasure of directing the project from an Ipsos MORI perspective. And I think for the next half an hour, 40 minutes or so, I wanted to walk through 4 things for you. So firstly, just a short introduction to the project. I'm not sure how many of you have had the chance to read the 4 reports. We've gone into quite a lot of detail in there about the methodology, but I just wanted to introduce at least the different objectives and some of the core aspects of the method, and then really focused on 3 areas of reflection that we've taken out from across the different 4 reports. And that the first of those is just thinking about social media as a method. Perhaps that's a bit of a hobby of mine, thinking about innovative research and what social media can bring to the table, but also thinking about some of the challenges and the lessons we learned in this project. I think also then just thinking about the role of social media during the pandemic, and it's received a lot of bad press, social media, over the last few years about trolling and the negativity that it can bring to society. But we've got some positive news and reflections, I think, today, just thinking about the way in which social media contributed to our experience during the pandemic. And finally, thinking about public health messages and how they've been communicated on social media throughout the course of, our fieldwork was, it feels a long time ago now, but it was back to February through to June, and we'll be trying to build on some of the reflections to think what that means for now and the situation we're in at the minute. Great, so firstly, this is the only slide I've got on method. Some of you might be pleased to know, but essentially what we did here is look at the objectives that were set by Future Care Capital. Each in their, they combined to an overall picture around what the experience looks like on social media, but we had 4 distinct areas of remit, really. The first of those was to look at just what constitutes a key announcement, what created the spikes in the buzz in social media during this time frame, and what did that mean for the areas that received a lot of attention, and perhaps some of those areas that didn't. And looking at what didn't appear in this query was just as important as what did. The second objective was to think specifically about public health messages and have a look at their performance, create a framework for judging the performance, and look at a kind of comparison between what performed well and what didn't. Thirdly, looking at a more kind of a specific area of interest within the health and social care professionals, and have a think about what did social media tell us about their experience and the implications for them during the pandemic, both in terms of challenges and potential opportunities. And finally, thinking more broadly about the wider public, what were the implications for mental and physical health. And this table just takes you through the different kind of stages of our method as we tackled some of those issues. And just to pick out a couple of things, I won't go through in detail, but just to say that this is a social media project, but it wasn't one in which we put in a few words and queries and presented kind of results back at a click of a button. We went through quite a thorough process, so that included, for example, manual coding of 100 posts, looking at judging the performance of public health messages, and that was really important. It went beyond what the technology and the metrics could tell us automatically, and we were able to bring some kind of researcher insight into analysing those. And we also harnessed kind of statistical analysis, so looking at topic modelling and factor analysis for objectives 3 and 4. And what that did is once we built a kind of refined query, it allowed us to let the data kind of lead the patterns and let us tell the story and model, and then look at how some of those the combinations and themes that were coming through, the groups of conversations, how they then mapped over time. And of course, one of the things we've done, and this was actually relatively new and innovative, at Ipsos MORI at least, is to try and triangulate that with what Google search analytics can tell us. So where were some of the trends that we were seeing on social media? How did they map to some of the trends we were seeing in search behaviors as well? So lots of interesting different methods, and do look at report 1 if you're interested in finding out a little bit more. Thank you. So the first area of reflections is around the use of social media and research. And I think there's 3 broad overall areas I'd like to talk about. The first is just, what does social media represent in terms of research? Who is it representing, and what can we expect in terms of what we're able to say, and kind of how robust is it, and how much attention should we be paying to the results? That leads on to thinking about data quality. And I think many of you on the call might be kind of familiar with what data quality looks like in terms of quantitative or qualitative research. I think in social media it falls somewhere between the two. And so just talking a little bit about what data quality looks like. And finally, also thinking about kind of the difference between automated and manual sentiment or metrics. And I think the reason why I wanted to talk about these 3 things first is because not only it sets the scene in terms of the later results down the line, but I think it's really important just to give these some airtime for you to help make your own judgments about the value of social media and what you're about to hear throughout the rest of the presentation. So the first kind of area of context, next slide please, thank you, is just to be clear, social media is not representative of the wider UK population. So we're not trying to claim here that what we've got in across the 4 reports is the same experience or maps and translates to the wider UK population. So lots of debate within the research world, really in the research sector, about the value of social media. But just to be clear, that there are, not everybody is on social media. Not everybody on social media is talking about the coronavirus pandemic, and the way in which they're engaging on these platforms is different as well. So we've said that this aims to be reflective of those posting publicly on social media during the pandemic. And it's important to be clear around kind of posting publicly, because lots of the areas of conversation on social media that we can't get to happen privately. So really, we're only looking at and able to analyse the conversations that are happening publicly. And it's just interesting, to break that down by platform too. So we have metrics on who uses social media, but you have to look beyond that. And we asked a survey question as well to complement the research, asking specifically about who's using social media at this point, and in what ways are you using social media during the pandemic. And so right at the bottom there is the stuff we are most interested in for this project, really. People posting their personal experiences. And of course, that only translated actually to 15% of the people who are on social media, let alone of the wider population. And you can see for all these things, sharing humorous content, as well as communicating with friends and family, that there are further skews, and that's typically the younger population and the more affluent who are engaging across these different activities. So just to be really clear and honest about who it does and doesn't represent, and I think the other thing just to say is that it also represents skews in data access. So we're able to harvest lots of conversation on Twitter and less so for some of the other platforms. And just worth, again, thinking about what that means for the types of conversations that people are interested in, but also the type of groups it represents when we're looking at their lives and their experiences as well. So this isn't to say that social media isn't really interesting. I'm passionate about it, and I think hopefully at the end of the presentation you'll see lots of value in it too. It's just that we need to be clear around what it does and what it doesn't represent of the UK population. So secondly, on this theme, just being honest about how difficult it is to find a relevant conversation or a relevant group of people on social media for a project of this nature. So we're limited in the amount of information that we know about individuals, and we have to come up with kind of innovative ways of using essentially Boolean search queries. So that's using ands and not or exclusions, and trying to both be as specific as we can with our query without losing too much conversation. And that's a real challenge, and it's an art as well as a science. And I think just to give you two examples of this, one where I think we got it right, and one where potentially we needed to do some work and come back to that query later on in the project. The first is that third objective around healthcare professionals, health and social care professionals. We couldn't find this group. They're not defined as a group that you can click a button for within your social media platforms. And so what we had to do is think innovatively about how can we identify this group. And we decided to build a kind of A4 page full of the different ways in which people may be expressing and telling us that they work in a relevant profession. So I've just picked out a few here, but that generated a fairly decent amount of content. I don't think it captured everything, but we were confident that the data we did get back was relevant and clean. And the second example is around physical health, and the query we developed at the start of the project was quite associated to kind of different aspects of maybe the outcomes that you should be worried about relating to physical health. And it was clear once we got towards the end of the project, in all honesty, that was too restrictive, and that actually many of the things that were relevant to physical health didn't use those words. So thinking couch to 5K, or you could have a post that just mentioned Joe Wicks. That would have been relevant to us, but we didn't know that necessarily at the start when we were designing the project. So you just have to constantly reiterate and review your queries. And the beautiful thing about social media is you're able to go back and make changes within the data set, and you get that second chance, unlike potentially some of the other research methods. So just sharing how difficult that can be. And finally, on this point, we were talking about kind of the fact that automated data and metrics only take you so far. So one of the questions we were set was, how do we assess the performance of public health messages? And you can see here we developed a framework that we thought was appropriate, and that actually, of course, if your message is to be successful, you need to reach a certain number of people. They need to be hearing it and reacting to it. So reach and the interaction with those messages is important, and we can achieve that by looking at some of the automated metrics. But we also wanted to look beyond that at a deeper level, thinking about what the response was. Did people understand the message? Were they talking about whether they were adhering to that particular piece of advice? And also just looking at the audience, was this something that was a buzz that was generated by the media, or a buzz that was generated in reaction by kind of public accounts? And you get a sense, hopefully, by that actually this is a conversation that did reach members of the public rather than just a conversation amongst kind of elites interested in politics. And you can see that what we've actually tried to do is we did this with a manual deep dive, and we applied the same way you would code an open-ended question. We had a framework, and we actually went through line by line, word by word, to assign posts into essentially whether things were a success or a failure, and aggregate those together. On the next slide, you'll see a really good example of this. So we created dashboards for each of our public health messages, and here you'll see a comparison between hand washing and face masks. And worth saying that the data stops at June here, and you can see there's lots going on in this slide, so I don't mean to bombard you with data and stats, but just to take a look at that second row for a second and compare the quality of the data we got from our manual sentiment analysis with our automated sentiment analysis. And you can see here that on the face of it, both hand washing and face masks received from an automated point of view around a quarter of the content was fairly negative. But when you did a kind of a manual assessment, completely different. You saw there that it was very positive for hand washing. 77% of the comments we got seemed to reinforce a message or give tips about how this could be applied, compared to something like face masks, where there's a much more even debate and lots of confusion. Actually, we've called this puzzlement. The 20% is one of the highest figures across the different case studies that we ran. It's just that extent to which, I'm hearing this message, but rather than supporting and getting behind it, I'm actually, the conversations that I'm having on social media are about, I'm confused, I need further help, it's unclear, and that kind of is a very different picture. So what we can see here is that hand washing, I think, trumps face masks on a numerous different kind of points, and actually was probably the best performing public health message that we had within our case studies. And on the next example, we've got the two big announcements, the two big slogans that we saw during the pandemic, and that was to stay at home or to stay alert. And if we only looked at the total volume of conversation, didn't look at anything else, you'll see in that top row in the third box there, 111,000 posts we picked up that were talking about the stay alert message. But actually, when you go under the bonnet, you can see that although again, automated sentiment looks about the same in terms of negative content, when you look at that in terms of the extent to which people are talking about it being unclear or they're confused and just whether or not they agree with it, at that point, it was performed much worse than the stay-at-home message, which didn't generate as much content, but the content and reaction that it did generate was really positive. And obviously, ideally, you'd like both things. You'd like great reach and you'd like the right reaction from members of the public. So just, please do go and look at the reports if you're interested in how we've generated some of the data. But I think that's a really interesting reflection of just how do you judge a public health performance during the kind of comms in social media. And I think it's just worth being cautious that we're not looking at just the automated metrics that you might get back if you're a comms agency or a kind of agency developing the brief, that you need to go beyond that and take samples of the data to get a good sense of whether your message is working and is effective. The next area of reflection is really on the role of social media during the pandemic, and slightly more reflections here, but probably the first three really can be grouped together. And I think one of the things that surprised us to a certain extent, I've done numerous social media projects over the years, and typically we're talking about quite a polarized conversation. It's just how much of the conversation was taken up by people being positive, coming together and spreading positive messages of support, either formally or informally. And then also wanted to talk to you about the extent to which social media offered a 360 perspective, both of the workforce involved, but also of the wider kind of UK public experience. And finally, its ability to hopefully hold to account some of the decisions that were happening along the way, and social media as a tool, not just to get behind, but also to critique some of the conversations was really interesting, and I think was a credit to social media, but it does have its challenges, as I'll come on to later. Okay, so taking the first three of those together, this for me was one of the things that I got really excited about, which is that these are the outcomes from the topic modelling. And again, we have larger versions of these in the report if you wanted to look at these in detail, and we take you through the different segments and what that means. But we've got two different models here. The one on the left was for objective 3, so that was taking all the conversations relevant to health and social care professionals and breaking that down, looking at where the co-occurrence of different words and then the volume of posts that mention that element of conversation. And you can see here that actually that kind of the top of the blue segments was all about the importance of health and social care workers. And so a huge conversation was just about promoting the value and the role of an appreciation for the role in which the kind of key workers and key health workers were doing as part of the pandemic. And then you also saw that in a slightly other area of conversation. And that was really positive. People not only wanting to raise this as an issue, but also taking their opportunity to say thank you to them and to colleagues as well. And you can see on the right-hand slide, this is the topic model that came out of objective 4. So this is thinking about mental health and physical health. And yes, we see people talking about how they feel, being angry, being depressed, talking about anxiety, and also their experience of living in lockdown. But if you combine all those elements of kind of green, slightly more positive conversation, so that's about sharing sympathy, sharing a positive vibe, sharing the different ways in which people might be able to cope, and that's either informally and formally as well, but also offering explicit advice and guidance about where you can go to get support and tips. And people doing this isn't just a course and package that they've kind of created before. This is people reacting and coming up with new ways in which they can support each other and sharing that on social media. So I wanted to present these two visual graphs as they give you a sense of the proportion of conversation that is relevant here. On the next slide, just to take that through in a little bit more detail. So we had so many different ways in which appreciation came through on social media, but what was interesting is that it shifted over time. And initially it was just focused on healthcare staff. And then as you saw throughout the course of the pandemic in our data set, the importance of social care workers was also really apparent. And you can see here, good example in the tweet we've got here. If there's one good thing about this dreadful COVID-19, it's shown us that the social care workforce is a great resource, and we must train, fund, resource, and cherish them. And so one of the outcomes and potential legacies was people talking about the value, not in actually financial terms, and what treatment do we have for these professionals in terms of the way in which the work package that they have, and the way in which we engage with them when we're using services. So lots of appreciation showed on social media. And on the next slide, you'll see for me that we had people speaking to strangers and sharing their own, look at these messages, look at all the words that we've got here of the messages that were shared within this segment. So people wishing and sending each other love and hug, and you can see in that bottom tweet there, I think someone's called it coronavirus kindness, which I think was quite a nice way of summing this up. And this is about people offering themselves as potentially being in a vulnerable situation, and someone else responding positively and trying to share some warmth, which I think was really important. And what was really interesting for us as we looked across the trend series of this is that this proportion of conversations remained constant, about 24% of all of that content we had in Objective 4 throughout that whole period. So people continuing, even as the latter stages of the pandemic, into June, as things were potentially getting a little easier, continuing to share positive vibes and informal support with others. But that also translated into formal support. So here we saw a really wide range, and this wasn't just formal government channels, as you'll see in that third bullet there. It was a whole range of different organisations offering, using social media as a way to advertise more formal support. So sharing tips, coming up with new guidance. It might be not to use an individual, but actually to the interest group. So you run a business and or you run a legal firm, and here's lots of guidance for you about what it means for you and the things that you can do to support your employees. So a real wide-ranging, different types of resources, from personal stories to documents that were quite heavy-going, but advertised on social media as a way to get that message out. And I think it was a real positive for us to see that, and just how much of that was sustained throughout the pandemic. On a slightly different note, one of the things that I'm really passionate about in terms of social media is its ability to take you beyond. We talk about it sometimes as research without words. And the same goes for maybe digital observation techniques, where you're looking at observing behavior rather than you setting the tone of the questions you want to ask and people responding to you. You're consuming what people are telling you, and you're then able to kind of understand and analyze and code that. And that was really clear throughout our kind of research here with the 360 perspective it gave, not only to health professionals, but also to members of the UK public. I think one of it was interesting, I think, the news story that was going around at the time, when right at the start of the project, was the clampdown from many health trusts that actually asked people working within the healthcare system not to post on social media. And we were able to capture a significant volume of people who still did. But what it taught us wasn't just about PPE and their challenges directly at work, was the other stuff that was going on in their lives. So this example here of someone who's really struggling because on top of everything else, of course, as many others did, I was one of them, having to juggle with homeschooling at the same time. And on the next example as well, the next slide, you'll see someone who's sharing that they're not concerned necessarily about being at work, it's what happens when they get home, and that the risk that they pose to other members of their family and their friends. And that was something that was really came through strongly. And you can see what the other beauty of this data set is, that you get something that's quite in the moment, quite near real time, and you're able to track that over time. And we can see the trends, and we can see the spikes and the events that they related to. And you can see here a good example of the kind of emotion that was being used, but actually the dominant feeling was one of anger. And that's that top kind of dark blue line that you can see that peaked just towards the kind of middle and end of March, but it still remained the predominant feeling as people move throughout the pandemic. Okay, and finally on this point, I think, for me, as I said, there are many examples where social media was able to provide a platform for kind of criticism. And you could see that thinking about health inequality, actually in relation to wealth rather than ethnicity, it was a niche area of conversation. It had the the smallest number of people but posting the largest number of times. So the ratio of people posting to the amount of content generated was quite powerful, and they were able to try and get that on the agenda. Lots of prominent politicians was well involved in that conversation, and social media provided a springboard to get an issue that was important onto the kind of the public conscience and agenda and into Parliament as well. But what's interesting is that actually some of the potential criticism or discussion of the theories, social media also provided a platform where disinformation and misinformation was spread. We didn't see a huge amount of this, but a really good example was around data and technology, people posting that actually this was in relation to kind of 5G and radiation. So I think what's an interesting challenge, I think, for social media platforms, as has been well documented since then, thinking about the US election, is how do you get that balance right? How are we able to take the best of what social media can offer in that situation, but also offer people the ability to kind of judge the criticism for themselves and its credibility. And that's something that was really interesting as people were talking about these different issues, the extent to which criticism also overflowed into unchecked claims about the alternatives, perhaps. So 5 reflections there, just to think about the role of social media, and I think broadly positive, but some room for progress and thought. So finally, this last section is all about the potential lessons that we've got for the role of public health messages on social media. So if you're thinking of using social media as a tool to advertise your public health message, hopefully this section is useful in just thinking about what are some of the tips that we came out. And actually, as I was kind of putting this slide together, thinking about what we've learned over the course of it, some of it is fairly obvious, I think, in terms of, you look back and it's easy to think, of course, these are some of the steps that should be taken. But it's just interesting how they played out and that they weren't always the case, and clearly not everyone following those lines of advice in developing their public health messages. So the first reflection is just around the role of media and events and how that can derail or support your activity. And it's worth combining that with thinking about who is your audience and also who else you might be able to utilize to help gain traction on your conversation. So some of those things are in your control, some of them aren't, and it's worth just reflecting on what you're able to do with that. I think the fourth challenge here is really interesting, just around how do you sustain and continue to get attention to your message in a social media environment that changes very quickly, and we've got some good examples of that. And finally, and this is an open question actually, and I'd love to have a discussion about it, is the extent to which this matters of linking your public health message to outcomes. And we've got a great example with obesity and physical health of a potential missed opportunity, but I'd love to know whether it's important to link it to outcomes, or just is the cause, and if people are doing that activity, doesn't matter why, but that's actually a positive result. So an open question on that one. So just to take you through these in more detail. So the chart here takes you through, and we've labelled the different peaks of different events and different moments that reflect and map to the spikes we saw in the social media activity. And you can see that, as expected, something like on the 23rd of March, where lockdown measures announced, and the kind of the different elements of recovery or lockdown extension are also reflected in the peaks. But what's interesting is that just a few days later, on the 27th of March, when the PM tests positive for COVID, that receives much more attention and buzz on social media. And again, later down the line, when we get to the 23rd of May and the story around Dominic Cummings, actually what was interesting on social media is that people were going back to then some of the messages that they'd received, and were starting to evaluate and comment on those. So some of the criticism and the conversation about adherence came several weeks and months later based on different events. And so it's just a really good example of how events gained more traction and buzz than some of the key announcements that came along the way. And one of the things we've done, and it's from report 1 if you're interested, is just looking at the role of the mainstream media in either propelling or I suppose not picking up, I wouldn't say silencing, but not picking up or giving due attention to some of the other issues. And you can see on this graph here, I hope this is clear enough, but it's a logarithmic scale. So it shows here that, the scale, if you can see here, the blue line, which is all about lockdown guidelines, the scale goes up in increments really, so we can get them all onto the same graph. It had 10,000 a day, 10,000 more mentions than people talking about shielding. and which perhaps isn't so surprising. But what it does mean is it's important to know if you need to get a message to those people who should be shielding and talking about shielding guidelines. You've got a huge amount of other noise and conversation to cut through to find this relevant piece of information. So not only who are you going to be targeting, but thinking about what else is happening and how can I grab that attention. And we've put in red there the line around kind of data and technology. I think for me that was really interesting because it was more of an interest, and we got more buzz of people talking about this more as a, what technology is being used, talking about the funding of it and some of the contracts involved. And actually potentially that made, arguably to the day-to-day lives of those people who should be shielding, they weren't getting those, the same attention and voice within the conversation that was happening in social media. So that was a really interesting lesson for us. And I think what we're not suggesting actually is that social media might have been the best tool. So what we'd have loved to do if we had more time is to triangulate that with other data sources about the coverage given in mainstream media to shielding guidelines. It'd be really interesting to see, did this same pattern kind of map out, or is there essentially another form of media and communication that was better suited to shielding guidelines? And just this was actually a plan from the start around knowing the audience online who use social media and deciding that this wasn't as relevant or important to them. So in both directions, thinking about your audience, but also around the areas of interest on social media, it's worth connecting that to your public health message. We saw that the public health messages that gained the most traction actually came from non-governmental sources. So just to pick out 3 high-profile accounts here that gained, you can see kind of written in small bold, just the total interactions here. Gordon Ramsay talking about washing your hands. Liverpool FC coming up with a nice poster themselves, but using the key phrases around staying safe and keep washing your hands, thinking about their goalkeeper, Alisson. And Sam Smith not promoting a specific activity, but raising awareness of the workforce. And you can see actually in terms of number of interactions and reaching a huge number of people to promote their issue, non-government sources were quite common and clearly contributed to a huge amount of conversation relevant to our queries. So alongside thinking about who else you might be able to get involved, the other thing that really caught attention and traction within our data set was highlighting real life stories. And we've included these 2 here, one from Piers Morgan and one from Lancashire Police, talking about a real person. And that was really important, that gained significant traction. There's more that I could include in here that come from personal accounts. One that sticks to mind that gained trumped both of these, gained 60,000 or so posts of a person saying, my dad is really struggling. Please can you help and support him and send him some messages of encouragement. And that gained 60,000 kind of interactions. So just to back up and support what I was saying about the idea that people were willing to take to social media to give each other some warmth of encouragement, we saw that really come through with personal stories. So think about how you might be able to utilize other sources and how you might be able to keep it real. So the 4th reflection here is just how do you cope with the challenge of the fickle environment? So the graph here shows in blue how much Google search activity there was around coronavirus, and in yellow how much buzz and conversation there was around social media. And you can see both of them steadily decline and having spiked in the middle of March throughout to June. That's not to say, as you'll see on the left-hand side in the bullets there, people were still telling us how the feelings of feeling sad and anxious sustained in volume throughout all the way through to kind of mid-June, and people talking about mental health sustained, but actually just a general interest in picking up other messages around coronavirus just seems, we seem to lose interest. And our reflection on this is just how do you sustain people's interest in your message if it's something that isn't a one-off and it's something that actually people need to be reminded of and keep on coming back to. So thinking about new and novel ways of engaging it. Don't blow your whole comms plan at the start. You're going to need to have different bursts and waves of activity to try and counter that, and that feels really important in the context of social media. A good example of this is the stay at home versus the stay alert communications kind of campaigns. And you can see, I mentioned on that slide a few minutes earlier just how much volume stay alert had. And you can see here that it was all within a day or two. And a huge percentage of that conversation, suddenly, conversation about it just dropped off. People weren't talking about it, weren't advising other people to do it. So it was a huge area of criticism really early on and then drops off completely. Unlike the stay-at-home message, which had support and reinforcement for quite a good time through March and April and into May, and even spiked again later in May as people are kind of evaluating that around the Dominic Cummings kind of activity. So that spike isn't necessarily a positive, but just if you're looking at the first few months and weeks of a particular campaign moment, they're really stark in contrast. And finally, I think my final reflection is just about a potential missed opportunity. But again, this is what I was referring to earlier about the extent to which it's important. So this really stood out for us in the context of physical health and thinking about obesity. One of my favourite quotes that we found throughout the whole project is in the bottom left-hand corner here. So obviously Joe Wicks had a lot of attention, a lot of publicity, and did a really great positive thing in engaging lots of young people in exercise. I think what was interesting for us is that all the comments around physical health and exercise were either talking really about structure and about helping out parents and trying to get some activity and engagement with their kids, or it was, especially at the early stages of the pandemic, talking about what you can't do, the restrictive nature of exercise. Please only limit it to these kind of moments of environment. There weren't enough messages on the kind of the lower right-hand side there of people promoting different activities, but they weren't linking it back to why this is a good thing, why you should be doing this, and why is this important in our fight against coronavirus. And I think so, great example here, just potentially a missed opportunity is that the mum or dad here who mentioned this actually saying this is a great thing, I'm worn out just watching, and actually wouldn't it have been great if the message was it's really important for the mums and the dads to get involved as well, rather than this just being a thing, a way of doing PE for those trying to homeschool. So I think, I'm not saying that it's, it might be more effective in other cases for messages just to get the desired behaviour change and the nudge, and that's the most important thing, rather than it coming with a message about why. But some of that's got lost in translation, I think, around physical health and the importance of kind of obesity and using that as part of our toolkit for the pandemic. So it'll be interesting to see if that sustains or changes for this round. So I think that's about it from me. Just to conclude, say, read more in the report, but it's clear that not all public health messages performed as well as each other during the pandemic. And I think we've talked about some of the reasons why some did very well. And I think what was really interesting is just to add to that, it's the reaction from members of the public and the extent to which they remained together and were cohesive earlier on. It became harder as the pandemic went on, I think, to sustain that, and people became more divisive, more critical. And I think that also had an impact in terms of our models as well. Just the way in which society reacted to public health messages in the pandemic shifted over time. Second thing, just a reminder that social media definitely provides a unique 360 kind of record or perspective, and I would just welcome all of you to have a think about how you can use social media data and analysis to learn more about your area of research or your topic of interest, and thinking about it both as a kind of qual and quant tool, as somewhere in between, rather than just about numbers and metrics. I think thirdly, let's see how we can best utilise social media to continue to play a positive role in helping the UK through the pandemic. There are definitely things there that it contributed to very positively, but some notes for caution. And I think it'll be interesting to see. We feel like we're a slightly more divided society now, and just whether we're able to sustain that. And then I think the fourth thing is just, if you are doing analysis, just be cautious not to overclaim on both the representation and potentially the quality of some of the social media data. Be honest, open and transparent. It's really important, and I'm really pleased that I've had the chance to do some of that today in talking to you. Great, so at this point, I think I'm handing over to Annemarie.
You are, thank you, Steve.
Okay.
Thank you everybody for coming to hear about the research that we're really pleased to have undertaken over this last 9 months, working closely with Ipsos MORI. I'm Director of Policy and Strategy at Future Care Capital, and had the pleasure of seeing this really through from inception of a big idea really to working with a team that was very open to innovating, right through to the challenges and wonderful outcomes that we've now been able to kind of glean from all that work that you've been hearing about. So rather than going into the detail, what I'm going to do is try and tell you very briefly why we did it, what we learnt, and then what we think that means in a brief sort of 10 minutes before the Q&A. So I guess the rationale for this research was really that we wanted to do something during lockdown, and obviously doing research in a traditional manner hasn't been possible across a range of different disciplines, including our own. And because Future Care Capital has and places great emphasis upon data, technology and innovation in the context, in the course of its work, we wanted to understand whether you could use data and technology to look at data and technology in some respects, and their role in health, and in this case, public health. We also we were aware that we needed to capture fast evolving and in some senses unprecedented events that, whilst we've had global pandemics previously, although not in our lifetime, certainly haven't been data-driven events and captured in a way through social media that we now see, and to understand what that meant and think about how we could best harness the voices of our beneficiaries, because I think we've spent a great deal of time over the last few months as a society, perhaps globally, looking at numbers and statistics and graphs and curves. And sometimes that feels somewhat anonymous. So it felt to us that social media could really help to bring to life those voices. The reason for the particular focus in each of the 3 substantive reports that follows the methodology chapter that kind of underpins everything, I suppose, first and foremost, the massive importance of communication, which I think, if anybody was sitting between rugby matches or desperately awaiting Strictly Come Dancing on Saturday, they might have thought communicating the time of a very significant press release or press conference might have been useful. But this goes right to the heart of the matter. The Prime Minister's been on in the House of Commons in the last hour talking about the extent to which people are or are not adhering to the guidelines and may or may not be able to in some instances. And communication is absolutely vital if we're going to overcome the next wave, as it were, as a community, before we find a vaccine for this. So we also were aware that a lot of emphasis is being played on the NHS, and our work spans health and social care, and we were very keen to see what we could find out about social care, and I think that for me has been a real eye-opener and a key part of the work. But we also wanted to, in the doom and gloom, to look on the bright side and see whether or not this platforms that so much has been written about in a negative sense could actually be a real positive for mental and physical health. So, in terms of the first lesson, next slide, thank you. So, the first thing to say is, oh, you're going back one. We're back on a podium somewhere. There's a slide with a podium. That's the one. So, essentially here, the key finding from the report around communicating public health messages effectively for me was that there appears to be a symbiotic relationship between that which was said at the press conference daily by the Prime Minister, Minister and other Chief Medical Officer, Chief Scientific Advisor and others, and what then got talked about on social media. So whereas you might imagine social media this place where it's a democratic conversation, it was quite clear that if it wasn't spoken about at the podium, it really didn't appear to translate then into mainstream media questions at the press conference and with that press coverage. And there's quite clearly much higher traction for messages that obviously come from big mainstream media accounts on social media, so they do tend to skew the conversation. And key from that for us was that we could find very little, if anything, really talked about social care until we had Matt Hancock at the podium talking about having thrown a protective ring around social care. And so it seemed to us that there's a number of lessons to learn from that. So if we move to the next slide. So thank you. So essentially, we realised at that point that we were contacted by members of mainstream media once he had spoken, and the message had travelled that there was a problem in care homes, most perceptibly. It was clear that the mainstream media didn't know how to cover the subject, and when they asked questions, it seemed that they lacked data to actually do their job as journalists. So for us, we created a very rapid, practical response to that problem and pulled together a social care data finder to help them find information. But it was, albeit it was still clear that a lot more needs to be done on that front. And the lesson for us in terms of bigger picture post-pandemic is that clearly there is a massive emphasis upon fixing social care as a policy objective for the government. If it doesn't talk about social care, others won't talk about it. If it doesn't talk about it, others won't understand what it is and what it isn't and what it does. And it seems for us there's a really big lesson in that, in terms of how getting these messages to travel to particularly younger generations so they know what it is and what they're being asked to think about, paying more tax for, some kind of social insurance in future. Next slide. So, move on a slide, thank you. So here we find that the second lesson for us was that there was this very, number 2, thank you. There was a very simple beginning, in a sense, for public health messaging and their efficacy. So it was really simple to say, everybody stay at home. It gets much more complicated when you start to unlock and say, we're going to unlock things in a different way or in new ways that we're none of us familiar with. And I think then the bottom left picture really is to suggest that it's much more hard and more difficult still in the last 3 months, I think, because of devolution. Because you've basically got these very different approaches for lockdown areas until the weekend taking place around the country, and people then on social media confused as to which rules apply to them in which place, and where things are changing on a regular basis as well, confusion within a community about what's happening. And I think some of the calls and support that some policy positions have had around whether or not to have a national approach really highlight for me the extent to which the general public is not really au fait with mayors outside of those areas that have metro mayors. And actually there's been this challenge to try and understand why people feel they should be treated the same in a unified fashion, and this idea of fairness around it, and why they might more readily be treated differently, and why that might be more fair. So I think those are 2 very interesting kind of aspects of the recent debate post the kind of research that we did with Ipsos. And then on the right, there's just a really complex diagram there from a wonderful blog from the Turing Institute, if we go back. And then this is to really tell you that the medium distorts the message. So it's not only that you're fighting against competing voices in a massive echo chamber, potentially, depending on who you follow, but it's to say something of the challenge that the actual Twitter algorithm, Facebook algorithms and other such build into your messaging strategy if you're a public health communication professional, because frequently there are bots mobilized around 5G, coronavirus, tinfoil hats, and all those sort of kind of terrible, now increasingly anti-vax stories, which are set to be very problematic, but they are in some senses baked in. So I was particularly pleased to see Twitter, for example, publishing and prioritising the Department of Health's messages at the top of its feed for everybody when they type pertinent terms. So the next slide. So we move on from this complexity page to talk about battling the coronavirus. So the Prime Minister was very clear that he was fighting an invisible mugger, and it was there has been a very visceral sense in the language used by politicians and officials alike that we're battling something and this is a war time footing. And I think that's fine, but at the same time we've got these 2 things that are on the left and right of this slide, which is around, we'd found on the one hand that we're not all created equal, we're not all impacted equally by the coronavirus, and at the same time you've got a very strong sense of inequality around the Black Lives Matters protests. And for us that proved really challenging, or rather it did for Steve's team, because how to separate out masses of data about the Black Lives Matter campaign to make sense of what was being talked about by those groups interested in the unequal impacts of the virus on Black and minority ethnic communities was really challenging. I think there was also a lot of clapping for the NHS and a lot of weekly occurrence of that, and a lot of chatter about it on social media that changed in tone over time to become less favourable. But there was less about the blue light ending to that clap for carers kind of period. So you can see a waning off of like the impact and efficacy of the message around supporting the workforce really visibly. And I think going forward on the left bottom there, this picture is meant to really denote that we see strike action right now amongst the health and care professionals around the world. This last couple of weeks has been in Spain. And I think there's a sense that from clapping, something different needs to happen around messaging for the workforce this autumn. And certainly needs to potentially recognise that we're talking about people who've been on the front line in a war zone, if that is a battle, more than most others, and that we need to think potentially about how we would treat our veterans and why we would treat our healthcare workers differently. Growing instance of PTSD and other challenges there to kind of unpack. So moving on, conscious of time. Thank you. So on the eve of the election, I couldn't resist this last slide really, just to say to you that I think if I was to put my crystal ball into action, I think it makes it much harder this second time around lockdown and the messages that we might expect. I think that's because we have got massive uncertainty over in the US with the election outcome tomorrow or Wednesday by the time it comes through in full. and equally with what happens around Brexit. And I think what we're seeing is, in addition to this initial everyone pulled together, we've now got to learn to live precariously with uncertainty for a period of time that we don't know how long it is. And I think that added to which, you've got the sort of economic uncertainty that's now obviously impacting more deprived communities very visibly. And so I think that we'll start to see a very different narrative this autumn and winter. And the left side then, just to tell you that I think what this means going forward, in terms of where to next, I think we need to recognise in the government pulling together the national data strategy that there is tremendous benefit at looking at social media data and not just health data to understand health. And I think it would be remiss of the government not to recognise that, along with many other types of data sets. And how do we get public benefit from privately controlled data sets? I think we need to think also, though, at the same time, as Steve sort of highlighted, what are the current limits to data in policy making? So how far can it take you, and at what point does it not give you the insight and understanding you need to translate the data and the trends into actual policy decisions? And then finally, I think there's a big gap between machine and human learning here. So the machine can learn what people are talking about and so forth, but in terms of people catching up and taking on from that volume of information that they're presented and bombarded with via social media, we just need to be mindful that while the machine's talking about the whole maelstrom of the conversation, that individuals may miss key messages very easily. Thank you. We can't hear you, Sue.
Thanks very much, Annemarie. Thank you, Stephen. Can you hear me now, I hope?
Yes.
Fantastic. We are going to move on to questions now. If you have any questions that have been sparked by these really fascinating presentations, and please just pop them in the box on your screen. I'm going to start off with a question that was sparked, I imagine, by both what Annemarie has just ended up saying, talking about machine learning, and what you also said, Stephen, and I'm going to hand this question to you, Stephen. The question is, I'll read out the question. It was interesting to hear about the importance of manual coding alongside machine learning. What lessons would you see there are for policymakers about the limitations of machine learning? Stephen.
Great, thanks. So I think it's a really good question, and definitely echo Annemarie's kind of final conclusions there. So for me, it's only as good really as a couple of things. One, the data that you put into it, which I think there's, to a certain extent, there's not enough transparency about how do you create good quality data, especially in a social media context, to feed something like that. Of course, then the human decisions that you make along the way, and I think not only that's about upskilling and working with people who understand those, but it's a combination of different skills from a kind of qual and quant angle, and also thinking about just a framework. And I think that was really important. Don't just be led by what the tech can generate and then try and work out what that all means in terms of your answers. What we did for this project was come up with a framework of what do we think are the important questions to answer and the components of those, and what would that like look like? How are we going to go and get the data? And that means utilizing machine learning in some contexts and not in others. And I think that combination and understanding how data analysis fits together is really important. And I think the final thing to say is that just knowing whether it's any good or not. And I think there's a lot of work being done on the extent to which, with human review, your ability to understand whether the machine learning has worked or not. And that's been a transparent nature, so someone else could replicate it or could understand and critique the decisions that have been made. That scrutiny is really important, and we haven't yet got a collective conversation about what that looks like.
Thank you, Stephen. I'm going to hand over a question now to Annemarie. And you began to mention it a bit in your talk, Annemarie. Could you say a bit more about the topics that were discussed online and why you think that was? And do you have any tips specifically for those of us focused on the issues that didn't gain so much traction? Particularly, you mentioned social care.
Sure. So I think the conclusion that we jointly reached was that, for example, shielding wasn't something that affected as many people as wash your hands, which is everybody. And so that those things, then it was harder for them to gain traction as messages because a smaller number of people were necessarily concerned about them. I did wonder when we did the research why it was they struggled if, for example, family members were supporting people shielding, and they would have had a sort of secondary audience for the message that were interested in them. But we've seen even in the last 24 hours, I think the announcement was made obviously about the second lockdown on Saturday night. Guidance has begun to drip out over the last 24 hours on the web. And has been updated through that period. I think I'm right in saying this afternoon the shielding guidance has been updated. But if you search for it before this event started, you'd have found very little to point you towards where the new guidance was, because I checked. So I think it's a challenge of numbers, sheer numbers, but it's also about interest in key topics. So it's clear that if you keep talking about social care as care homes, the public will gain the perception that you can fix social care by fixing care homes. And I think we run the risk, if the podium does start to talk about social care and it only talks about it in narrow terms, of not really explaining to the general public what social care in general does. So I'm not sure I have any solutions, which is bad news, unless we can all find Allegra Stratton and she's prepared to say the right thing at the podium. We could struggle. But I think there's a job of work to do around educating the mainstream media and providing them with the right data so that they can tell the stories that are needed to educate people.
Great, thank you. So Allegra Stratton, I hope you're watching. And then moving on to one last question. I think we only have time for one more. Thanks everyone who's given the questions, and sorry if we haven't been able to take everyone's. The last question is going to be for both of you, and I'm going to start with Stephen and then move to Annemarie. And this is the question. We are just days away from new restrictions in England, so essentially a second lockdown. Do you have any predictions for online conversations during this second lockdown, similar to last time? What differences? Over to you, Stephen.
I think my hypothesis that it would be a very different experience on social media. I think one of the things that we saw as an emergingly polarized debate was about, as coined by some people, kind of health versus wealth, or just that conversation as we were starting to ease lockdown restrictions, or as they got extended, people posting in that kind of classic social media way that we've come to love, just about a slightly more kind of polarized position and stating their preference, and at times being quite challenging and robust in some of the things they've said. And I just wonder, I think that started back midway through this kind of through this project, and we feel like we're in a very different place right now, and that debate has only is increasing. And I think just we had that luxury at the start of the last one where lots of the conversation was about people coming together and being positive, and I just wonder whether we're in the same place and we'll have that same experience this time around. So all of the great things I've talked about in terms of social media being able to be a place where we can encourage and support each other, I really hope that it could continue through the second time round, but I would be surprised if it did to the same extent.
Thank you. So good and bad news. Annemarie, over to you.
I think it plays back to some of my final remarks really around the kind of uncertainty surrounding what happens tomorrow on the other side of the pond and what happens here at the end of the year with Brexit. I think compounding kind of big uncertain events like a pandemic and whether restrictions will be imposed and then lifted and when, with political uncertainty and potentially considerable economic uncertainty that will flow from those events, is really going to colour things. And I think the other thing to say is clearly we see the rise of, I think I saw Nigel Farage speaking at Donald Trump's rally over in the US at the weekend, and it's clear that he's making some kind of comeback, and that kind of leveraging those voices around anti-lockdown kind of style coming from the US and maybe translating here could be a really challenging force for public health communications.
Thank you. So rightly connecting us with the wider context. Thank you very much. It's been a fascinating session. I'm really grateful all of you for joining us and grateful for our speakers. So there's a kind of virtual applause to all of you. And before you go, I just want to say that we have a follow-up event. We really want to zoom out a bit and look at these continue to explore these themes in a wider way with representatives from public affairs, from polling, from government and from charities, and continue to reflect on where social media can play a really great role, and the challenges and opportunities and lessons for public health communication at this rather difficult time. So I want to say thanks everyone for coming, and good night.
Great, thank you.
Thanks.